dynamics. And I wanted to use this as an opportunity to expand a little bit upon the comments I've made now on 2 occasions. On that first day, Monday, where we were giving an overview of the techniques, and I noted the attention long played in system dynamics to group model building, participatory engagement, and yesterday I noted it as well. And I had meant to offer a comment actually yesterday that you can actually make more sense of the system dynamics body of work and way of operating if you think of it as kind of a combination of participatory action research with dynamic modeling. There's a tremendous amount of the system dynamics community that is interested not so much in contributing at a distance studies from topics of interest, but involving stakeholders and being part of actually making a difference. And a lot of system dynamics, for historic reasons, also goes on in a context outside academia. It goes on to some degree in the corporate world, but nonprofits as well, foundation-based work, and that's partly a reflection of its history, particularly in the 1970s. You'll find that once again there, a lot of it is sort of engaged with policy makers and so on to make things happen, and there's somewhat less emphasis on academic sort of goals than you might expect. So I commented on Monday about, yes, it was Monday, I guess, about sort of 3 modeling eras where early on dynamic modeling and system dynamics was very much dominated by a perspective of, come to us and bring to us your problem, we'll study it, we'll model it, we'll bring you the answer. Later, and this still goes very much on in some worlds, like up in Canada with the ModSim work, the work with life paths and the Canadian Partnership Against Cancer work with microsimulation. Models are distributed as kind of these black boxes. The people who are using them don't know what's in them. They can be very sophisticated models, but sometimes they're shocked, and I've seen that happen firsthand, where they're shocked to find out, oh, you mean that's all it represents about physical activity and it's linked to obesity? That's it? I thought I had a much more bigger representation after years of using it. That being an individual-based microsimulation model. And I see tremendous opportunities in this world that we articulate, borrowing on concepts from software engineering, for what we call Agile Modeling, which is basically interdisciplinary teams surrounding a model that's quite transparent across the team. The end user customizes outputs of interest to them, but also scrutinizes the model, gives feedback on it, runs it first themselves, and takes ownership in a way that steers it as a learning tool and as a living document. And we are seeing increasing the ability to pursue this sort of work, not just with system dynamics, where it has long had a home, but also with agent-based and hybrid modeling. And much of our work in Canada with stakeholders, with policy stakeholders. I'm trying to think of a project which does not have this with policy partners, because we believe that the value conferred by this is so great. So I'm going to skip over many of these things we've covered previously. I've noted the value of the modeling process. A large emphasis within system dynamics and within our work, much more broadly than system dynamics, has focused on participatory engagement surrounding models. So we're talking here about specific repeated avenues of discussion between stakeholders and any technical individuals involved with the model to shape it. Sometimes the modeler, I can think of times at the Sachs Institute in Sydney, Australia, where we have a student over there right now. Another student came back in December or November. Another student's going over in this coming December, and basically sits among health scientists focused on health policy, and builds models side by side with them, and they meet with various governmental stakeholders. These sort of participatory processes seek to capture qualitative understanding from very early on about what's really going on in the system, far from just relying on data, which is often far from coming from heaven. It's comes from very particular processes and has certain gaps. The simulation model is used to sort of stir up the dialogue and serves as a tool for scrutinizing the assumptions. And the emphasis here is on declarative specification. We could never do this if we relied only on code, so we rely very much on visual models. Now, system dynamics has provided that for decades now. In agent-based modeling, it's coming to the fore. It's coming to the fore in AnyLogic as a tool, but also coming to the fore in Repast. And I think it won't be long before NetLogo complements its very rich visual output interface with some representation of the model logic. And certainly that's the centerpiece, or a centerpiece, of one of the research programs that I lead, funded by the Canadian equivalent of the NSF, is focused around novel modeling languages. These goals are designed to stir up stakeholder participation. Now, why do we want this participation? Maybe it's obvious to everyone in the room, but as a young engineer, it wasn't obvious to me. Well, one thing is that the model incorporates a rich, grounded understanding of what's going on. By grounded, I mean it's coming from people in the trenches. It's coming from the people who are part of the system. And you may get understanding that you would never secure through data in this context. Secondly, it can build community capacity, or capacity of these stakeholders to pursue their goals. So by working with them, they get trained in these methods and how to use models to think more crisply and rigorously, and learn more quickly from evidence in a way that empowers them to achieve a difference. And when I say community here, I don't necessarily mean a community out there in the sort of general population, but I could. Peter Hoffman does a lot of work with communities. He does work with inner city groups. He does work with villagers. So it can be communities in that context. And for those of you familiar with participatory action research or participatory health studies, this is a familiar sort of notion that we build capacity with research assistants from that community, etc. We get critiques of model behavior. I noted earlier that on the first day, I think, an odd fact, and it took me years to get through my thick skull, just how true this was. Kurt may have seen it on his first assignment because he engaged in embedded modeling. But often there's an awful lot of tacit knowledge that people don't volunteer up front if you have a modeler formally interviewing them and say, tell me about your understanding of the system. You get a lot through that, and I've done a huge amount of that with stakeholders, eliciting this knowledge. But where you get a lot more yet is you actually get them interacting with a model that's running. That might not be your final model. It might be, we're going to talk best practices later, and it may be the model you're very early on the stage, but the point is that interacting with that model elicits knowledge because it's tacit knowledge. It's knowledge that they're not aware explicitly that they knew until something reminds them of it. So critiquing model behavior is often the source of eliciting further knowledge that they hadn't previously brought to bear. And you don't want to complain about it. It's a great opportunity to know that your model's off base. You learned something. Everyone's learned something. That's great. That's a step forward. Fostering stakeholder cooperation. If stakeholders are involved in designing this model, there's a sense of ownership that can build up. There's a sense of of contribution and buy-in, but there's also a sense of, look, this is a group effort, and we're contributing to it. It's not the domain of the, that sort of funny-looking skinny guy with glasses in the back or something like that. And that's very important. The cooperation space. You heard yesterday me saying System Dynamics fostering cooperation is one of the big goals of modeling projects. They consider it a success even if the model vamooshes, it disappears afterwards. If they stimulated the cooperation, they've achieved the goal of the model. It's not so much that they're always searching out a research question so much as they're trying to catalyze change. And some of you may have heard, when I circulate to teams, I'll ask the question, what would a successful modeling project look like for you? What would success look like for you for a model? That's because it's not always answering the question. Often it is. Often it's getting an answer to a technical question. I spend a lot of time in that, but sometimes it's catalyzing change or catalyzing how people change and how they think about the system or work together or what have you. Stakeholders are a lot more likely to buy into changing policy recommendations if it's coming out of a model where they've shaped it and they've contributed to the set portfolio of possible policies to evaluate. They've advanced policies they think are realistic, etc. The technical person involved in modeling may have very stylized thoughts about what a policy would be, and often they're taken off the table because they are politically inexpedient, or they are totally unrealistic, or they are potentially would be seen as transgressive to certain groups. And you're more likely to get realistic policies and policies that people will buy into if they're at the table. Participation can also facilitate communication with those involved in data collection and sort of surveillance if you're dealing with public health agencies. And can also aid, because the model is then understood on an ongoing basis, on replanning and keeping the model updated. Peter Hoffman speaks a lot of time. Peter's an extremely interesting guy. I think of myself as kind of having a varied background and so on. Peter dropped my jaw when I met him because he, like me, is an engineer early on. We both went through very technical engineering training. But after his bachelor's, he got a PhD in social work. And so he has this very technical, quantitative base, but also this understanding the human theater and sort of the human sphere and aspects of psychology, aspects of the social domain that I have much to learn from. Peter talks about the dignity of risk, and it's a term that he borrowed from a philosopher whose name I forget about, maybe Habermas or another one. He talks about, look, if you're building a model that affects people, isn't it only justified? Isn't it only just that the model creation involved them at some level? If they're the ones who are going to bear the consequences of what the model might suggest from a policy perspective, isn't it appropriate, and doesn't it confer dignity to involve those people who are affected? And so he has a moral argument for involvement, which I think at the least makes one pause for thought. So participatory modeling, as we'll see, it comes in a wide variety of forms, and it turns out that, as we'll talk about, people who pursue this as their central focus of their modeling efforts, which does not include me. I use these methods, but my research doesn't center on how to do participatory modeling better methodologically, but there are a group of people who do, and Peter is one of them. And such people tend to be very, very particular about what's meant, and the particular sort of uses of the term of the terms have very specific connotations. I lack that refined sense of sort of the nuances, and so you can't use this this presentation as a firm guidance for what the proper terms are. But broadly speaking, I see a spectrum of participation that we've engaged in. These are some of our projects where we go from something where the engagement is basically we have a built model, a model that's incorporated as best we can, understanding from formal discussions with stakeholders in the past. And we took this understanding, we took the data they pointed us to and the points from the literature, we built it into a model, and then we show them the running model and say, help us understand if you think this aligns with what you believe is a good representation. Let us know if the outputs from this model look reasonable to you. Are there any concerns, etc. So there you have a built model, and you have them engage it. And in system dynamics, this is extremely common. You'll basically have 20 or so people in a room. They'll be running the model interactively because they can run it like that for different scenarios. They'll be trying scenarios and making comments, and there's often a goal there of eliciting feedback on the model, but also trying to sponsor learning from the model. And that engagement can build capacity within the community, but it also can provide important priorities for future work. On the flip side, there's what I call group model building, which actually involves a very tight-knit. I shouldn't say tight-knit. It's a very tightly planned context for actually building up a model from the start with input from a group. And we'll talk about that as the extreme along those lines. And we build models sort of all along the spectrum. TB prevention control, we'd have meetings every 2 weeks or so for the core parts of the project where we'd go back and say, this is what we've done, this looks reasonable, get feedback, get critiques, talk about the outputs, etc. Okay, now, so group and participatory modeling comes in a variety of forms. And as I mentioned, practitioners are very particular about the language by which it's described, the process undertaken in sessions, the composition of the team, of the sort of, it's sometimes called the core modeling team, meaning the set of people whose job it is to run these sessions, to sort of facilitate them, etc., and the roles taken on by the team. I at one point in my career, this was 2011, I ran a conference focused on group model building. I was amazed at just how very involved people got in the terminology used and just wanting to be very, very precise about these things. Because there's a notion among some people, like when I first saw this sort of participatory modeling, I thought, oh, that doesn't look that hard. I could do that. Okay, so you go and you facilitate a group and you lead them through exercises and you get feedback from them. I can do that. Very straightforward. And what that belies is the fact that it's actually quite codified how people have thought through these exercises and have meticulously documented tools that work, tools that don't, barriers to effective input from people, including power relationships between people in a room. Think you have a homeless person and you have a doctor treating them for HIV/AIDS in the same room, and then you have people who are working towards a bachelor's degree, people with high school education who are community workers, and you're trying to elicit knowledge, and there's a real danger that the voices from corridors of power will drown out others, and there's ways of avoiding that. Yeah.
Yes, this may be more. Feel free to put this aside if it's more relevant later. But I think one thing that might be useful is that it's sort of easy to think of this as like a modeling utopia where everyone's ideas come together, and it might be useful to know like when things go wrong.
Yeah.
It seems like the power of things, but what are some of the ways for people going in to watch out for in terms of avoiding pitfalls?
Yeah. I think there's a number of them. One of them is the meeting because the meetings are designed to bring together people from very different communities. And one of them is the people in the community start to fight, right? They start to go after one another. And say, look, that's what you're always saying. You've never paid attention to our work, before. You're the ones who get the money, but we're the ones who do the work, that sort of stuff. The power thing is another side. Someone's voice doesn't come up. Another thing that happens is people are just silent and don't give significant feedback. In terms of each of these, there's certain roles. I'll come on my next slide to it. There's certain roles that people are designed to play within this team. So you might have a team of something like 8 people, and each of them has a role to play in the engagement. So these are some example roles: the note taker, the model curator, the facilitator, the timekeeper, the gatekeeper, process coach, etc. And basically what happens is, and this is just a subpart of the team, I would invite people who are interested right now, before I forget, I created for your browsing here a tiny URL. It's to a thing called Scripta, so it's an A, not an O, Scriptopedia. Okay, tinyurl.com, Scriptopedia, with a capital S, although I'm not sure how particular it is to that. And if you go, it's, by the way, it's got the American spelling of pedia, there's no AE. Pedia, okay? And if you go to that, what you'll find is an online book. Oh, that's not what I expected to find. Okay, tinyurl.com, Scriptopedia, boom. It's got a wiki book, and you will find in here, glossaries of terms, group facilitation notes, and you'll notice these sort of provisos or suggestions associated with this. There's also a more fulsome discussion on, for example, the roles here, and much of the goal of these roles is to be able to replan. So Dwight Eisenhower said, the plan is nothing, planning is everything. Clausewitz said, no plan survives contact with the enemy. And the point is that they go in with a very specific plan, but often what happens is things go awry at some point. They're not getting the feedback from the group. There's a conflict or what have you. In much of the sort of assignment of roles, not all, but much of it, and much of the thinking that goes into it, and particularly having people like a process coach there, is to be able to replan dynamically if needed to respond to these issues. So you have someone who's done dozens of these things and can sort of swoop in and figure out how to disentangle two groups, or how to move the discussion forward. And some of the individuals, are watching out, like the timekeeper, and someone whose job is reflection. So, and I don't have an easy answer for each of those situations on how to handle it. What I do know is when the teams go in, they have people whose job it is to try to make sure that that even if unexpected things happen, they can respond to them dynamically. So there's a detailed plan that goes in, and it is intricate, and it might involve 3 planning sessions before the full one, before the actual meeting. 3 2-hour planning sessions, so they know exactly what they're going through, who's doing what, who's going to be standing on the board, and so on. And yet they're ready with a community facilitator and a facilitator and a process coach, someone whose job it is to reflect. They're ready to sort of take it in a different direction if needed. This is beyond my my sort of level of familiarity with these things. We don't engage in this level of preparation except on 1 or 2 occasions. But it is something which those who do this for a sort of the central part of their career really emphasize. Peter Hoffman is one. Another group is that at Albany with George Richardson, particularly David Anderson there, whose basically life and work surrounds this. Jack Vanix in Guelph, not the Canadian University, but in Holland, Netherlands, is another one who specialized in this area. And I would refer people who are interested to Peter's book on community-based system dynamics. This is a very, very good book, and much of it is about engagement in a way that could be carried over to other types of modeling. Scriptopedia is a good reference. Another one, which I don't have up in here, is Jack Vanek's book called Group Model Building. And there's a further book on participatory action research. I remember roughly the author's name. I think it may be Krishnamurthy or something along those lines. But I will try to go get the reference for you and put it in here, which Peter I know also recommends. I've co-supervised a student with Peter who applied this in an indigenous context. Ended up going on and using it with some of the First Nations in Canada, and from working with those who have indigenous theory background, who specialize in indigenous means of and perspectives and health research, I understand that it's closely tied in there. Peter also is, in addition to his other many strengths, he's also a sort of a committed feminist. He very much is interested in feminist philosophy, and he also sees strong feminist links to sort of feminist theory within this work that is beyond my familiarity. So within this context, there are, commitments to use models as boundary objects here. Within these exercises, whether it's a small one or a large one, whether it's at the beginning of a project or later, you're using formal constructs of one sort. When I say formal, I use that term in a broad sense. A causal loop diagram would be an example. A stock and flow diagram would be an example. A sketched out set of state charts from an agent-based model would be an example. Basically, you use these to catalyze the sort of discussion and to focus feedback and so on. And the different groups within system dynamics differ in the degree to which they actually try to build up a running model in that session. As I understand, I think there's a rift. Well, okay, rift is too strong a word. There's a difference of opinion amongst, within the system dynamics community, those who lead this. Some say, you got to get a running model out of the engagement, out of that meeting. If you're leaving it without a running model, you're leaving behind a lot of potential. Others say, look, that's not necessary. We can get a really rich causal loop diagram. And sometimes what happens, talk about sort of things that require replanning. Sometimes what happens is, it took me a while to get this through the skull too. A lot of things take a long time. One thing that really came out is that if you listen to Peter, it's true that it's easy for us to think in sort of a utopian sense that this is how we get better knowledge of the system. But often what happens is that you have within the same room people with different perceptions of the situation. And you want to be very careful about assuming that they're all just pieces of a global consciousness of the system and all just little glimmers of a hologram, or something like that. In fact, you may have within the room people whose perceptions of the situation are very different from the perceptions of others. And being true to capturing each of those is important. Now you may ask, well, wait, we're trying to model underlying dynamics, underlying processes. Why are we dealing with perceptions? Because perceptions are central to shape people's actions in the system. They're central for explaining why people behave, why they don't engage in care-seeking behavior because they believe that they're looked down upon by the dentist. because their language skills are very, very poor in English. Why is it that this group doesn't work with this other? Because they don't feel respected. It's not always about understanding at a technical level, what the true situation is about sort of the underlying processes outside of people. People are part of the system. And understanding perceptions is key for understanding that. So models as boundary objects helps us elicit different viewpoints on given issues. And sometimes what happens, if memory serves me from Peter's engagements, is they'll actually come up with several different maps for different subgroups. And that may require splitting the room dynamically, so you have one group over here, one group over there, to create different representations of how they see the system, and then probably some attempt to help them understand each other's viewpoints, and then subsequent engagements which might try to bring broader perspective to things.
Can I speak to
Yeah.
that? So it's interesting. There's especially with the rise of machine learning, there's this
Yeah.
idea of the Netflix challenge. You guys ever heard of this? Where Netflix offered $1 million to anyone who could improve their movie prediction algorithm, and people submitted models, and somebody's model was the best. But then they combined these diverse models, and the outcome was much, much better than any individual model. And now they're starting to do that in social science, and I think it's just a matter of time until they start doing this in public health, like trying to develop a set of diverse models where they're trying to maintain diversity of the
Yep.
models, because
Yep.
each one represents a distinct perspective.
That's right.
So it seems like it's interesting because on the one hand, in system dynamics, the aim often, it seems like at least the classical aim is a single model but I wonder if over time, ultimately, people would be more comfortable having diverse models representing a diversity of perspectives.
Yeah, I think that's true, and I will tell you that in our group, and Kurt was just commenting on this a day or two ago, that within a given project, or certainly program of work, but often within a given project, because we built things iteratively, and because we have the same students are trained in system dynamics and agent-based modeling and hybrid, often we'll have multiple models bring to bear. And it's not just iterations, but sometimes it'll be a system dynamics model and an agent-based model. And it's not, well, one might predate the other, because often with system dynamics you can create very quickly a rough and ready model. And it takes a bit longer to create an agent-based model. Not always for very trained students, but basically you end up with learning from both at the same time. It's not that one leaves the other behind. It's not that this one is outdated and we'll only use the newest one or something like that. Actually, you learn different things from each of them. There's certain experiments you can do in one that you can't do in another. But more to the point, there's different the different ways they frame the situation give you different insights. And so it is, I think, with the models that come out of group model building. I agree that having several different sort of takes on a situation can be useful. And that's actually a notion that some, like Yanir Bar-Yam at the New England Complex Systems Institute, he's very keen about this idea of having multiple teams working in parallel to build on projects. And for some cases, like civil engineering projects, it's not obvious how that would work. You're not going to build several Brooklyn bridges or something like that. But in some contexts where there are resources, it makes sense. And the Midas project had some elements of that, I think, in a good way.
Midas was a famous project to study flu evidence.
Yeah, models of infectious disease agent study. Was it a UO1? I don't. UO1 funded by NIH. I think CDC may have been involved in that too, and it had some work in Canada actually on compartmental or basically SD models as well. That went on. Okay. So one thing I will say is, a lot of the time the initial modeling is done in the group context, but not in fact very commonly. Tempted to say the vast majority of times, although I don't know that with certainty for the different people who do this. Basically, the model that started in a session is taken away and finished. When I say finished, I got to be careful. It's not finished. It's refined. it's refined elsewhere. What I mean by refined is the terminology is made more consistent. People's feedback is discussed and incorporated into that for the next engagement. And so they'll present the sort of updated model, because it's too much often to do within a context. So system dynamics, we saw yesterday that there's, within system dynamics, whether it's causal loop diagrams or stock and flow diagrams, often they can be fairly easy to understand. We've done similar things with agent-based models. This was state charts related to gestational diabetes for this context, and you can see it gets pretty messy sometimes. This was after a couple hours of kind of placing down links by individuals, sort of about what brings people from one state to the other, what affects the rapidness of that transition or the likelihood that will occur. And people stick on these sticky notes which describe their understanding of different relevant factors. And they're sitting around a large table. In this case, this is with this butcher paper, and putting these things in and commenting and having dyadic discussions and so on in ways that are often quite rich and themselves revealing. I have real issues with this technology being used. I think it does not lend itself to a good a kind of very easily understandable thing. This is from a different project, also in Australia, where they used what they call blue tack or sticky tack in strings to sort of connect things, and again, they're linking it up to kind of representation of agent dynamics with state charts. And we've been going through successive iterations of a language for agent-based modeling and agent-based and hybrid modeling, which incorporates this but does it much better. There's my colleague Jeff McDonald looking critically on an emerging diagram. And typically the people here are from diverse interdisciplinary backgrounds, contributing in this group context and having discussions. And there'll typically be a set of engagements where they'll contribute something, there'll be an attempt to simplify it and bring it back to the group for further comment. There'll be attempts to combine certain linkages, which two people suggest something that's more or less the same thing. They'll work to combine them and to simplify these elements. You might be surprised. Many of the people here in the room are eminent scientists in Australia, and there's a certain aloofness sometimes people at that level have at first. They think like, come on, are you asking me to play Monopoly or something? At the very start, but actually they really get engaged often. That's actually a minority of people who have that attitude, but I've seen it. It's like, here I am used to serving on high-profile blue ribbon panels for the government, and you're asking me to muddy my hands with this. But they actually get really engaged, and it ends up being quite a lot of fun, and to a certain degree invigorating to sort of have a broader brush thinking through of what elements of literature are relevant for whatever things. As someone who doesn't work overseas, I've also been intrigued by the work Peter's done in rural villages. This from India, and this is this case where the woman I mentioned the other day comes in and points out this missing thing in the model and says, "You're missing this issue about the Jersey cows. You should have had that link in there." And once again, it is something where you have this model developing. You'll notice this is a causal loop diagram. Causal loop diagrams are particularly easy for those from all sorts of backgrounds to understand. You don't have to explain stocks versus flows. In other cases, Peter, this is from Mongolia, I think here, Peter uses stocks and flows. And typically what you have with stocks and flows is, a 2-stock model or a 3-stock model. It's a very simple construct that you use to focus discussion and talk about some of the core dynamics. and you talk about additional variables which are of relevance. And again, it brings the group to as a group reflect on what we know, what we don't know in this area. Peter has a lab at St. Louis. I believe this is a depiction in the lab here. I think this one as well, where they bring in community members for these sessions. They'll do other sessions at churches in the inner city or high schools, but they actually designed this lab and placed it in part in a way that would not involve the participants having to come to campus, like to familiar campus, because they said for many participants who live in inner city St. Louis, the idea of going to the university and sort of going among the offices and so on is very overwhelming and very intimidating. So they wanted something where they could have a safe space, for people from different backgrounds. And so they'll do it here, and often they're on a very casual basis with those, from the community. I work with others, particularly at Harvard School of Public Health, doing community-based research, and it's a very similar set of needs there. It's just here we do it with the modeling. And there's this extra need to make sure that the modeling itself doesn't seem intimidating, that it's like, that this is only geek stuff, and, you need a PhD to understand this, and only those with the education should comment on this. There's a real need to kind of build relationships, build trust. I mean, it's the standard thing with participatory methods in general. You work to build up the trust with these participants. You have long-standing engagements. You have many meetings to build up a sense of comfort. You draw on their social networks rather than your own to bring people in. You want a champion or two, in the community, and each community to sort of take these ideas forward, and you got to listen really carefully to their feedback. It's a full in sort of process, and I have nothing but the highest respect for those who undertake it. Peter's commitment is very much at the community level rather than at the level of higher level stakeholders. But by contrast, you'll find in the literature about group model building, Jack Venix. Jack Venix he wrote his book on group model building, 20 years ago now, and his focus was in corporate context, bringing in groups of people from the same company to talk about corporate strategy and to plan. And as you can imagine, that's very different. There are power relationship issues, but the levels of education are less disparate. The different perspectives are less disparate. So if you go to the group model building literature, just be aware that Peter's stuff is probably of greater relevance to health. Peter was someone that he did some wonderful work in health in the past bunch of years. But when I had met him, a lot of his work was outside the health space, and I tried to do what I could to encourage him to come into it. He didn't need much encouragement, and he came in, and he's just contributed so much since then. It's amazing, and I have so much to learn from him. Different technologies. So there's some barriers here. This is not all roses and peaches and cream. There's some big barriers. With process, you're limited to co-located individuals. It's hard to bring people in from underserved communities across the nation, underserved Hispanic communities across the nation to talk about barriers in their communities or attitudes towards care seeking or what have you. It's hard to scale effectively to large participant pools. You think about bringing in 100 people. How do you hear those voices? This is a real challenge. And it's difficult to even sometimes seeing a diagram with a large enough room. Think about a room like this. Some of those in the back may have trouble seeing, this sort of text. I think I might. But if we had a diagram which was getting increasingly large and we had lots of words on it and causal loops, you might find it really, really hard. And there's constrained access to physical representation. Those big things with butcher paper require people to kind of push in and modify things. And at the same time, they lead to dyadic discussion in small groups around it. So there's positives and negatives. There's difficulty communicating to audiences with multiple languages. Much participatory work goes on in multilingual communities where people are marginalized because of language or culture or what have you. And it's hard to reach out to those in multiple languages in the same room. And this is one of my biggest concerns. There's a tremendous amount of discussion around the table. My colleagues like Jeff, like in these groups, some of the people, I guess they're actually people taking the picture, but like Jeff's actually one of the members of the team who's sponsoring this, and so he was looking at this, trying to figure out, okay, what are the barriers for people to process barriers, as well as sort of looking at the diagram and trying to figure out how it can be simplified, whether there's big problems because now we have two different sort of duplicate representations of things, or some areas of it are occupying way too much space, disproportionate to others. But one of my big concerns is that justification and stories are lost. These people circulate around the table, and they might hear glimpses of the conversations that are had. But for the modeling team, often those are not captured. Now, from a system dynamics perspective, well, a lot of the good has been done because you get people from very different backgrounds talking to each other, and they share their different perspectives, and you catalyze cooperation where it wasn't in place. You help people meet each other. That's the purpose of much of system dynamics modeling, is sort of catalyzing that change. On the other hand, for modelers, I think it's really valuable to know, why did someone put this link in? What were they thinking? What were they drawing on that new study that recently came out, or were they harking back to a discredited earlier study? Did they have a firm basis for putting this in? Was it based on some personal experience? Even who put that in? It's hard to record right now. And the reliance on hand-built diagrams is also challenging. I thought I had, and maybe I don't. Yeah, hand-built diagrams can be messy. Changes to them can be burdensome. Imagine moving that sticky tack. You got to pick it up and move it over. You got to recut the string because it's got to stretch further. It's horrible. To me, as a technologist, it's horrible. You got to go and you clip the long string. Actually, sometimes we stretch the strings, but then they can lead to weird ballistic effects where it gets loose and it throws the sticky tack. Sometimes it's unreliable in terms of just keeping it together and so on, and there's limited confines of the space. With content, stock and flow and causal loop diagrams are really difficult for capturing agent-based and hybrid features. I say inadequate. What I mean is they show difficulties on some common things. And I encourage students to innovate, but we should do it in a coordinated way. We should do it in a way that learns from best practices, learns from broad experience, not just each student's on his own to innovate it. And these are some of the characteristics that are missing from agent-based and hybrid modeling. Multi-level context, the ability to depict. Often in a system dynamics causal loop diagram, you'll have variables that relate to very different levels of the system, an individual and the overall environment, and they're just variables next to each other in the diagram. It's distressing to me to see it. There's an inability to characterize causal loops with respect to distinct agents sort of separately. Capturing agent environmental context, spatial context, or one or more types of network links. Things, I might be in an IDU network, I might be in a sexual network, I'm in a family network. Family and friend network, which can transmit norms, attitudes, beliefs. IDU and sexual network can be different routes for HIV transmission. Capturing these different environments is very difficult here, and then capturing categorical changes also in a causal loop diagram is difficult. And there are ways to try to ham-handedly, put these things in there. But really, I think we got to do better. So one of the projects in my group, we have a pretty large lab. It's about 15 people, and we have one student working right now on building a Google. Well, Elizabeth saw a version of it last year, and now it's being modified and made much bigger and more sort of more inclusive. Basically, a Google Docs-like tool for doing this electronically from many people simultaneously. So just like you can have Google Docs, multiple people editing the document in different areas at the same time, and it can record who did what, when, and comments from them. We're recording similar things, could allow it to be displayed in multiple languages, for example, so you can translate it from English to French or to Chinese and see the diagram in that. You could have explanations behind particular variables and capture people's meaning and have an audit trail when people rename things, who renamed it, etc. So, and version control for it. Anyway, this is our vision. It's not a silver bullet, it's not a panacea, but we're doing that for agent-based and hybrid modeling, and causal loop diagramming will just be a subset of it, is what it comes down to. Let's see, right. I will just say that with agent-based and hybrid models, we're less far along in terms of languages. We've gotten a lot out of some basic languages associated with state charts that are in a form supported by repassed and AnyLogic. This is an AnyLogic. It sort of codifies behavior. In this case, it's behavior associated with mule deer in the wilds of Saskatchewan, wandering, and you can see this kind of fawn movement and random eat-drink movement and seasonal gender-based movement. And these are sort of nested constructs depicting the possible states that an agent could be in. States with respect to certain types of movement, states with respect to disease progression, and states with respect to sort of their health status and with respect to aging and some aspects of their health status. It turns out that these state charts provide a useful way for talking about dynamics among categories. So an agent can be in this category or that one. It can move from this category to that one, but not from this other. So we've used state charts a great deal in this sort of modeling to good effect. You saw some of them earlier, and it's part of our modeling language. We also have other constructs for agent-based modeling, including things like events. But we further have things like parameters and to encode an element of characteristic and networks and geographic context, etc. A key thing in my mind about modeling in this space, and I got to finish up here, is getting the programmer out of the loop. I tell people, and I'm actually deadly serious, that my most dear hope, my dearest professional hope is that I put myself out of a job. Hope that my students can replace me in what I do and do it even better than me, and we're looking encouraging in that. But more to the point, I'm a software engineer. Depending on who you talk to, I'm a software engineer and gone bad or gone to the light side. And I'd like to eliminate the need for sort of people with formal programming training needing to be the ones who are called on to be sort of the person to implement a model. Getting that programmer out of the loop for learning is one of the most important things I see in these team-based exercises. I think it's very deleterious for a team to learn from a model if to add a new output to the model display or to modify a model assumption or to run a new scenario, they have to go through a programmer. They have to go through someone who programs it up. It slows things down. It raises risk of sort of phone, that old game of phone where distortions are introduced. The programmer needs to understand what you mean, and if they don't understand, they may capture it in a way you didn't intend. And it limits the ability of the stakeholder and the team to really be confident of what the assumptions are in the model. So much of our goal for our methodological work is getting it so programmers don't have to be involved with that as soon as possible, and working with stakeholders to empower them. We do these boot camps which are geared at building up teams, not just the person changing the model, but training teams to work together on these sort of models so that all the team members are empowered to work with the model. But ultimately, the full realization of this is going to require a change in technology, and we're working at that. But with AnyLogic as a tool, we found that we can do a pretty good job getting stakeholders able to add new tables or new statistics, or modify assumptions, understand assumptions, modify scenario assumptions, add new scenarios, etc. And trying to separate that out from the model. The model shouldn't be tangled up with the outputs. It should be, this person wants to view the model with these outputs, this other person wants to view it with these other outputs. I won't go into this, but this is much of my methodological work, is sort of better languages for ABM. So just as we can build a system dynamics model that focuses on the what of the system without programming in a traditional sense, we can do most of that with agent-based models and allow for them to be very, especially transparent. Okay, modeling for teams and communities. I haven't done this full justice. I'm not an expert who specializes in this like Peter Hoffman or David Anderson, but I hope that gives a little bit of understanding of some of the issues there. It's a wide open world, and I couldn't give a stronger recommendation than to Peter's book, Community-Based System Dynamics. Don't be turned off by the title. Peter, like me, is very interested, and in fact a partner in adapting these techniques for other types of models. Maybe I'll just say one final thing along those lines, because and we can maybe have an early break, something like that. Yeah. Ladies and gentlemen, as Bob Dylan sings, times they are a-changing. The world of system science and health, and the world of complexity science is evolving with it. We're going to hear later about some of the most exciting forms of that, the advent of big data to inform models and so on. But one thing you should realize is that system scientists are people too, and they have all the foibles of people. And unfortunately, system science, I shouldn't say unfortunately, that will come later. System science derives from many traditions. The microsimulation tradition comes out of econometrics, agent-based modeling. Well, a lot of it arrived, at Los Alamos from sort of combinations of physicists and computer scientists, and some social science import as well, I'd say. System dynamics from sort of a control theorist, Jay Forrester, and technologist. Discrete event modeling, which is not talked about in here, but as a notable tradition, kind of came out of industrial engineering. What you'll find is that the system science community is still somewhat tribalist. Okay? There's different communities for those different groups. There's a microsimulation conference, happens every year or two. And you go there and you won't hear anything about system dynamics. You go to the system dynamics conference, you hear a wee bit about agent-based modeling. But back when I was most active in it, they seemed to, as Jeff McDonald presciently commented, they seemed to stuff us into the smallest of rooms for our sessions, which would then get packed with people. they didn't give the biggest sort of forums for it. And I think there's still some lingering suspicion that, of my consortation with agent-based models. Agent-based modelers, there's unfortunately a history of what I would call sort of bigotry against system dynamics by agent-based models, with them sort of thinking it's kind of dynamic modeling for kids, and is sort of a weaker form that will be supplanted. Not all. It just there are some prominent voices that have come up with this, and it has led, not surprisingly, to recriminations on the other side. And about 10 years ago, it was particularly bad, and I was sort of viewed with suspicion a little bit by people in both camps, because I don't worry about these things. I just cross the barriers and people will be suspicious. These days it's gotten a lot better. I have to say, in the past 5 years, I've been really impressed that there seems to be a maturation to realize, look, one is not going to totally get rid of the other. One is not, in a millennial sense, the kind of thing that's going to revolutionize everything and get rid of the others and so on. But there's still a lot of tribalism there. And I hate to tell you, but if you go submit something to System Dynamics conference that's on agent-based modeling, you will sometimes find that bias. And sometimes if you have your RO1 reviewed by people with a discrete event modeling or agent-based background or microsimulation background, you will find critiques that aren't very kind or, in my mind, very informed of the system dynamics, etc. So there is still quite a bit of tribalism. But the newest generation, all hope lies with the proles. Well, all hope lies with the newest generation, to adapt George Orwell. And I guess I'm too old to be part of the newest generation, but I'll put myself in there as an honorary member. The Krugerian generation, the Krugerite. Kurt's a good example, but there are others who view these as not as some weird tradition they'd never heard about in grad school, taught by other people, and just sort of a quirk of the landscape, but rather come to realize there's actually value in these different traditions. And people like Peter Hoffman, who specialize in system dynamics, still really, really value agent-based modeling. And I could say the same thing. It's been such a pleasure to work with Elizabeth and work with Ross, who may specialize in agent-based forms, but are very open-minded. And so don't be discouraged. If you do go and publish and you find the occasional barb and so on, don't be discouraged, and don't believe that these are deeply seated prejudices which will never disappear. The world is imperfect. It's still evolving. The older generation is a little bit old school in terms of some of its cherished prejudices. But things are evolving. And in health, it's my biggest conviction that these techniques complement each other and work together. We'll talk some today a little bit about the trade-offs between these techniques and so on, because there are trade-offs, and it's not to deny that. But just realize that it's a broad world out there. There are people who will cling very much to one approach, but there's a large group who acknowledge contributions to both. And if you are looking for guidance comparing them, it is best to talk with someone who's done both a lot and has an open mind to it, because there's no shortage of partisans who are very prominent who will say, never do that, always use my approach. And what can we say? We're people too, and people have weaknesses.
I mean, I think sort of the state. We'll say a little bit more about the state of the field tomorrow in our closing statement. But I mean, one of the things that I think NIH was very effective at was developing a critical mass of modelers who were in the health domain. And was it 2 years ago, OBSSR convened a meeting of the people they viewed as kind of leaders in the field, about 15 people who were system dynamics people and ABM people, and Nathaniel and I and Ross were all part of that group. And the consensus around best practices was pretty striking.
Yeah.
I think that especially as it becomes a more diverse field, there's a consolidation
Yeah.
where there's recognition that people within system science as a whole need to have a unified front around what
Yeah.
the best practices are within this area.
And that's a very good sign.
Yeah.
And it's a very good cause of sort of looking forward for prospects as well. So even if you go to the conferences, you'll find them a bit campy, a little bit focused on their own methods and not really talk about others. But really, we are in a world where there's a lot of recognition of the value from key players now in the health space, and that's nothing but a good thing. Yeah. Okay. I think we'll stop for a break now.
So it's 10:18. Let's say that we'll come back at 10:38-ish, and then we'll probably dive into big data and sensors.
Yeah.
And all
Yeah.
that
That's
cool stuff.
that's right. Yep. Thanks very much, folks.